Hello friends, and welcome back to my channel. My name is Bailey Tarosian, and today I wanted to kind of talk to you about my 20-week scan, walk you through what I went through, how everything went down, and just kind of talking about some things that have happened within this last week or so within my pregnancy that I have been just experiencing and I want to share. So let's talk about it. So as of this past Monday, I was 20 weeks pregnant, or I am 20 weeks pregnant. And I am very excited about this because every single week that we have is 1 week closer we get to meeting our little girl, Camilla June, which is the name that we've chosen for our baby. And I am just so excited every single week that passes. I'm just ready for her to be here and hold her, and I'm also ready to not be pregnant anymore, to be honest, because I want my body back. I want to be able to move around more freely without feeling out of breath, but mainly I just want her here with us because I can't wait to start being a parent and just take care of her and do all of that. But anyways, 20 weeks pregnant this week, and it has been quite the journey. Something that came up last night was that I started having spotting, and it was pretty dark compared to most of my spotting that I've had throughout the pregnancy, both in the first trimester and the second trimester, because I've experienced spotting just a lot throughout the whole pregnancy. And every time I get scared because I am just so worried, and I really just care about my baby's health and well-being, and I haven't been able to get any sort of answers on why I have been bleeding. And so that's been really scary, but we, after crying and having a whole emotional overwhelm situation, I ended up getting into touch with the doctors at labor and delivery at the hospital I will be delivering at, and they were able to kind of calm my mind that I could make it until today when I had my 20-week scan, which we did just a few hours ago. And I'm going to kind of talk to you about that today and just some of the things that have been going on with me. So I went into my appointment today feeling a little nervous because the doctor on call last night, when I told him I was having spotting, I've also been having like very severe nosebleeds that last like 45 minutes, and it's just been a lot of bleeding, and it's just not fun. And I've been feeling a little dizzy. I've been having some blurry vision. He told me that blood pressure issues and stuff like that, normal blood pressure variations and stuff, can cause some blurriness, a little bit of dizziness and stuff, and it's not anything to be concerned about unless it's severe, which I could say it's been severe, but it's been on and off, so not as bad as it could be, I guess. As far as the spotting though, he kind of just told me he believes that, based off of what I've told him, that I probably just have a sensitive cervix or something to that effect, and that's why I've been having the spotting. So, but then my actual OB, once she was able to respond to me this morning when she was back in the office, she did kind of tell me that she thinks that it was maybe placenta related. And so today, when I had my scan with the maternal fetal medicine doctor, who's been practicing for like 40 years and who is probably one of the most experienced people at the hospital that I'm going to in maternal fetal medicine, he was able to really take a good look and reassure me on some things and kind of clarify a few things that I've been kind of wanting to know. So at my 13-week scan, the nucholucency ultrasound or nuchal translucency ultrasound, I hope I'm saying all of that right, everything came back normal, but my doctor, the different doctor I'd met with in maternal fetal medicine, she told me that I had an anterior placenta, which basically means that your placenta is like on the front wall of your uterus. So it acts as a pad that sometimes can block the feeling of your baby's kicks, and I believed her, and I really didn't think anything because I don't know anything about anything, and so I went home, and then a week later I started feeling my baby kick very hard, and I've been feeling her since then, just getting progressively more active and kicking harder. And so I started having doubts that I really had an anterior placenta because I could just feel baby girl kicking all the time. And then I met with my OB, we did a quick ultrasound, but it was really just to check for the heartbeat, just very, very quick in and out 15-minute appointment since it was not a big scan. And then I've kind of just been waiting, a few weeks for another appointment, but I did end up going into the ER because I had some spotting about 2 or 3 weeks ago. And during that ultrasound, I was told that I had a low-lying placenta by one doctor, and then I was told that it was just outside of being a low-lying placenta by another one, all within the same visit. And also I was told that it was posterior, and I was just like, okay, I don't know what's going on. I feel like I'm being given a million different diagnoses here, so to speak, and I am very confused about it. So then today when I went in for my 20-week scan, they basically just, it was a kind of like a normal ultrasound. It just took a lot longer. First, I had the ultrasound tech come in. I believe that's what she is. I'm not great with all this stuff in the medical field, but the ultrasound tech, who is not the doctor, she came in. She did a very thorough scan. We spent probably 45 minutes, and halfway through, she had me go empty my bladder because I was not aware that you need to empty your bladder before the later scans. I know everything I've read has basically said before an ultrasound, make sure you hydrate, make sure your bladder's full, but I guess that's not the case at the later ultrasound. So I personally recommend maybe calling ahead, getting that information so that way you're not like confused like I was today. And we came back, I had to roll around a little bit because my baby girl's head was just not in a great position for the scan, which was the same as the last one. They had to do a suboptimal scan at the last ER visit we did because baby girl was just hiding way down in my pelvis, and just very hard to get a good look at her. During that time, she didn't say anything looked concerning, and I know the ultrasound tech's not really supposed to diagnose anything, so I wasn't expecting that, but I was starting to feel more relieved because I feel like if there was an issue, I might be able to tell off of body language or something, and baby girl looked active and good and all of that, and so I was starting to feel a little bit more relaxed after yesterday's spotting incident. And then after she was done, she had the doctor come in to evaluate me, and we kind of talked over some of my concerns with the spotting and the kind of, you know, the nosebleeds and this and that. And he basically told me he thinks the nosebleeds are totally normal and just to try using a saline solution. So if you're pregnant and you're suffering from really bad nosebleeds like myself, we're gonna give that a try because I'm willing to try anything at this point that helps to get rid of these awful nosebleeds. But he said with the spotting, you know, sometimes there just isn't a definitive reason, but other times there is. And so he made sure that we were going to do a very thorough check on my placenta to make sure there was nothing out of the ordinary. He was a little concerned about a potential previa, but yeah, after looking at everything, it ended up being totally fine. I don't think most people get a vaginal ultrasound this late into pregnancy, but he did do a vaginal ultrasound after just doing the normal abdominal ultrasound just to check my placenta because my baby's head was also like right down there as well, and they wanted to get a good measurement on her, but also because I was just really worried, and I was like, at this point, like I would rather go through the awkwardness of another vaginal ultrasound than not know. And so he was able to do a vaginal ultrasound that showed that my placenta was actually very posterior. It's way far enough up where it's not going to cause a previa, you know, at this point, and we can feel pretty good about that. And that made me feel so much better having somebody who was a lot more experienced and who actually took the time to do a vaginal ultrasound to kind of confirm that. But we also were able to get measurements from my baby girl's head, which was awesome because we weren't able to do that last time. And he said her brain looked great, everything looked good there, and he wasn't too concerned about anything. So yeah, so we're kind of back to this is just random bleeding that just happens, and it's probably just a sensitive cervix or something to that extent. But yeah, he wasn't able to give me a definitive answer on why it happened, but at least we know it's not a placenta problem, which is very good. So after this 20-week scan, feeling a lot better. It did take around 45 minutes to an hour. We got to the appointment a little early and they were able to get us in early, so I'm not exactly sure how long it took, but probably 45 minutes to an hour just to go over everything and to ask our questions, and then also for him to set up that second ultrasound, which I don't think most people would do, but it was definitely reassuring for me as a worrier to get that double checked and to make sure that baby girl is good and healthy and growing. All in all, I think that today went pretty good. It's just insane, and if you're somebody who is a first-time mom right now, or even if you're just, you know, any sort of mom, I think it's just crazy seeing your child in your room kicking and moving and growing, and it's just so crazy, like especially as a first-time mom, seeing my baby move around and get big. Like, she's so big now compared to what she was just a few weeks ago, and it just brings me so much joy, you know, in these precious moments, like knowing my baby is just growing and she's safe and sound in there. And I don't know, there's just something so awesome about it, but there's also a lot of uncertainty that comes with that. And so I'm hoping for a calm and peaceful rest of the pregnancy, even though you never know what's going to happen, but I just have to kind of trust that things are going to be okay at this point, and have some, you know, take some deep breaths and just be reassured that my medical team is there for my benefit, even when sometimes it feels like overwhelming and scary. But yeah, that was my 20-week scan experience. Make sure you advocate for yourself if you are somebody who's currently going through a pregnancy. Sometimes even the best doctors don't always think about certain things, and you know your body best. And I know I've had to advocate for myself and ask a lot of questions to get some of the answers that I needed, like today, without having called a bunch of people up last night when I was having spotting. I don't think that I would have gotten the more thorough scan that I needed to really make sure that I wasn't having some sort of placenta previa issue or whatnot. So always advocate for yourself, always be the squeaky wheel, and remember that you're advocating for not only yourself but for your child, and that's really important. So anyways, I'm going to stop yapping now, but if you'd like to connect with anything else related to pregnancy or being a first-time mom or just being in your mid-20s and trying to figure it out because life is crazy, feel free to connect with me here on YouTube, but also over on my Instagram at Bailey_Tarosian, and I'd love to have a more in-depth chat with you. Always feel free to DM me, and love to chat more. So thank you so much for watching this video, and I hope I didn't yap too much unnecessarily, but I can't make any promises that I will stop. So yeah.